and welcome back to part 4 of the treatment paradigm series. We've made it to where we're just going to go over a couple of case studies. So let's get started. Our first case study is going to be a total knee replacement. And so with a total knee replacement, we're going to still go through those 5 categories, but we might bounce back and forth between 2 just because we're working different areas. And so here's the example. You would or could start on the new step. Say they're straight out of their knee replacement, you're on +1 visit. You could start on the new step, and then when they come in, you want to assess the asterisk sign before you get started. So we're going to take a look at the extension, and so we'll measure extension, see how we're doing, and then we could do some manual for some more movement prep. After we've done our manual for extension, we can check it again, see what we've gained, and then now we need to do our reactive work to reinforce what we just gained from the movement prep. And so here this is when we can do our quad sets, short arc quads, straight leg raises, anything to reinforce that extension we've gained. Now we've done our extension, we're going to move back into movement prep and look at flexion. So now we can do our manual, assess our flexion first, measure it, get the goni out, and then do some manual for flexion, and then reassess what we've gained, and then it's time to reinforce. So we're going to move back into the reactive time. And here you can do your wall slides on the mirror. You can use the T-ball and the strap and put them into flexion. Anything that's going to reinforce that flexion we've gained. For the first day, you might not make it out of the reactive work too much, but you can still, just so you can know kind of where things would go after this, you would probably not go to power too much right now, but you would definitely still be looking at some strength. So that's when we can do some sit to stands or getting on the shuttle and looking there. Once you've kind of gotten where you want to get with the range of motion and you're doing pretty well on the mat, you can, by the 2nd or 3rd visit, get them up and get them on the NeuroCom or looking at single leg balance at the stairs for more reactive work there. And so next case study, we'll look at a shoulder patient. So we'll look kind of at a rotator cuff repair. This one we are going to have our protocols that we need to follow. So in the first couple stages, you would stay more in the manual and reactive work. You wouldn't be getting really far around that pie chart. But further along in their treatment, their warm-up could be included on the arm bike. If they're not there yet, they can be doing the foam flexion roll. Just get those tissues warmed up. Then you could go into some of your manual, getting those last few degrees. Again, this is going to be later on in a rotator cuff repair. So just chasing those last few degree in ranges. And then you're going to reinforce it. You can reinforce it with some isometrics, isotonics, getting that in range, anything that's going to take them to that in range there and activating the muscles. Then you can move into some power. With this, you can look at doing quicker movements, anything that's going to move that shoulder around, but we're going to be doing more high, not the strength type stuff, so making sure our resistance is still low on this area. Then you'll move into the strength. And so with the strength, that's where you're going to be starting to add those weights in. You might be doing some lifts or carrying overhead. Anything like that will go in this category. And then remember, you always want to cool down, so maybe you'll do a little bit of stretching or anything with some deep breathing exercises just to cool down the tissues and get them prepared to go home for the rest of the day. And so those are just a few case studies that we went over just to give you guys some ideas on what this is going to look like. When we set up the flow sheets, it's really helpful when you're setting them up if you set up kind of the order you went in your treatment, so you know you can drag those boxes around. And I like to set up that way this system is easily reproduced. If it's already in the flow that you did it, the next person who gets this patient can just kind of go down that flow sheet and add or take away what's needed that day. So just keep that in the back of your mind. I hope you learned a lot from this treatment paradigm series. Again, it's good just to keep you on your toes, keep you always thinking about why you're doing things and why you're doing it at that certain time. So I hope you enjoyed, and thanks for watching.